Welcome back to Great Day. All right, this is crazy. We have over 60,000 miles of veins in our body. That's enough to wrap around the world up to 3 times. When there's a kink in that very long hose or things aren't going with the flow, you'll feel it. Symptoms may include heavy, achy legs, wounds that won't heal, and bulging veins. Dr. Rajiv Agarwal with Modern Heart and Vascular Institute joins us with a modern, quick, and non-invasive way to treat vein disease with little to no downtime. Good morning.
Good morning, Deborah. How are you doing?
I'm doing well. All right, Dr. Agarwal, when it comes to vein disease and poor circulation, a lot of people feel it, but they don't recognize it, and oftentimes can be misdiagnosed.
Yeah, a lot of people are misdiagnosed with either restless legs or neuropathy, and it really is their circulation problem. There are 2 types of blood vessels that we have in our legs, Deborah. There are arteries and there are veins. And it's very important to distinguish the symptoms between 2 because they're very different.
Yeah, you know, a lot of times people will have like the open ulcers on their legs or the bruising, and they'll think that that's a dermatology issue, and they go to a dermatologist, but it's not. It won't heal because of that poor circulation. All right, between arteries and veins. So arteries, poor circulation symptoms would be what?
Yeah, arteries carry oxygenated blood from the heart to the toes. So symptoms will happen with exertion. That's the key. If you have symptoms in your legs when you're walking, it's very likely to be arteries. So fatigue, tiredness, just burning in your legs when you're walking.
And then
on the venous side,
yeah,
you get symptom at rest. So this is the key for our listeners and our viewership, is that if you have symptoms at night, if you get cramps, restless legs, swelling, discomfort in your legs when you're sitting, standing, or at night, oh my God, can we help? These are very strong signs of vein disease, and it is so easy to fix nowadays, Deborah.
Yeah, and there are certain risk factors. Let's go through the arterial disease risk factors.
Yeah, the artery risk factors are similar to blockages in the heart because you're dealing with blockages. So that would be diabetes, smoking, high blood pressure, high cholesterol, and we'll throw in COVID nowadays as well. Whereas venous risk factors tend to be more of just lack of movement. So people that sit or stand for long periods of time, teachers, flight attendants, store clerks, secretaries, and being overweight is a big risk factor for that as well. And more common in women, Deborah, because estrogens also damage the veins and leads to these venous problems.
Yeah, all right. When it comes to the diagnosis process, this is something that's very simple for you all to do because this is your area of expertise.
Oh, that's the fun part, Deborah. People come in and we listen to them. We try to decipher what symptoms they have, and without doing too many tests on them. And then you examine their legs and you see if they have those varicose veins or color changes or ulcers or how strong are their pulses. And then you get an ultrasound, non-invasive, no pain at all. And you look at the arteries, you look at the veins, and you make a very accurate diagnosis and help them.
Yeah, and when you say help them, there are various ways to do that. There's a point where you become a sort of a doctor, a plumber.
Yes. So the treatments are different for the arteries and the veins. For the arteries, because you're dealing with blockages, it's not even done at the hospital anymore. You come in, you fix the blockages with a Roto-Rooter type of device, and then they go home within an hour or 2. Yeah. Vein disease, as you see on the screen there, is a little bit different. That's done in the office. Takes 10, 15 minutes. You come in. The key is to stop the blood flow into the veins that are causing the symptoms. So think of it like you're driving on a highway and there are 5 lanes on the highway, and 2 of the lanes allow blood to go both ways. All you're doing is, like you see on the screen, you're doing a minor in-office procedure to close the veins. And it's amazing how quickly those symptoms go away on these patients. We've had people that were barely able to walk, and then now they're dancing around.
Okay, so now you went from being the plumber to also directing traffic. Okay, you're doing all kinds of things here. But I want to touch on something. There are a lot of people who saw their parents, grandparents go through this. There's like vein stripping, all that type of stuff. And that's what's stopping them from coming in. They need to know that this is a completely different procedure today. Technology has changed things.
Yes, this is non-surgical. I mean, if someone tells me there's a 10-minute procedure that can be done and you drive yourself to the office, we do it, and you drive yourself right back home, it's just unbelievable. And the symptoms are so much better, not in months, but within days to a week or 2.
Yeah.
not just the cosmetics, but the quality of life change that happens for our patients is just mind-boggling.
Yeah, you don't have the achy, heavy legs anymore. You feel like getting up and moving around. You mentioned restless leg syndrome. I know there are a lot of people who take medication for that. And in your mind, you're saying instead of taking medication to address a symptom, why not get rid of the problem?
Exactly. Even my mom was put on restless leg medications 5, 6 years ago. It turned out to be it was her vein disease. We fixed the veins, and she's been off of 2 restless leg medications, and she hasn't had one restless leg in 5, 6 years now. So you got to have the accurate, proper diagnosis. So we can help with that.
Yeah, now you're a good son as well. There's all kinds of good advantages to coming to you. We've been talking about vein disease, which oftentimes happens later in life. But when it comes to cardio issues, you all also address pediatric cardio issues.
Yes, we're very blessed that Dr. Joshua Quinones from Texas Children's Hospital has joined our practice. So it's so nice to be seeing babies to little kids, and all the way up to advanced age, that we're able to help everyone in our office now.
Yeah. All right. Well, thank you so much for joining us this morning.
Thank you, Deborah.
All right. To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com or give them a call at this number. It's 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. And by the way, they have doctors who are fluent in Spanish as well.